Good afternoon. Let's call the February 25th, 2016 meeting of the Spokane Regional Health District Board of Health to order. First on our agenda is the roll call of members. It is clear we have a quorum, but let's begin with Susan.
Susan Boyson, appointed member.
Chuck Hafner, the City of Spokane Valley.
Lori Kinnear.
Kyle Unlin, Health District Representative, Division Director, Health Promotion.
Kevin Freeman, City of Millwood.
Keith Baldwin, appointed member.
Amber Waldriff, City of Spokane.
Michelle Fossum, Legal Counsel.
And Pittsnogle, Recording Secretary.
Thank you all. The next item on our agenda is citizen input. This afternoon, we are asking that our citizen input for this section be limited to those items not specifically on the agenda or an action item this afternoon, which is, for people not, is the resolution regarding electronic cigarettes. So do we have anybody, Ann, or on that list for citizen input not related to the resolution?
No, that was the other list.
So, seeing that we have no citizen input for agenda item number 3, let's move on to agenda item number 4, the chair report. This afternoon, I'd like to remind folks here that only 6 microphones can be on at one time. So, if we are speaking, make sure that when you're done, your microphone is off. We do have a quorum, and begin with the chair report. We'd like to welcome Kyle, who is our Environmental Public Health Division Director. He'll be standing in for Torney Smith this month while Torney is off in Washington, D.C. So Kyle will be giving the health officer report instead. Next is I'd like to address the Board of Health Structure and Selection Committee members. So those will be the folks that will be making up the committee to review the position description for our health officer, and also leading up the initial selection and review committee. So right now we're looking at making that committee up of the executive committee. So that would be myself, Commissioner O'Quinn, Councilmember Hafner, Councilmember Waldorf, and Susan Boyson, who Bob Lutz has asked that he be recused or excused from the selection committee for personal reasons. So Susan has kindly agreed to step into his place as the appointed member. So those 5 members of the executive committee will also make up the structure and selection committee. So that is it for the chair report today. Item number 5, the health officer report. Kyle?
At this time, there isn't a health officer report, but we would like to offer the chance of having one of our program managers, Rowena Pineda, come up and provide some information about Promise Zone.
So I'm Rowena Pineda. I'm the program manager for Neighborhoods Matter and Weaving Bright Futures. Recently, SRHD was asked to sign on to a memorandum of understanding in support of an application that was submitted by the Spokane Public Schools and the City of Spokane to designate Spokane's northeast quadrant as a promise zone. In the next few minutes, I will describe the area that the promise zone encompasses, what a promise zone designation means, and the commitments SRHD made for the promise zone. So this is the promise zone area. It's the area highlighted in pink. It's a little hard to see up there. Or residents simply call it the zone. It is a cluster of 8 neighborhoods in Spokane's northeast quadrant that make up the feeder pattern for Rogers High School, which is the city's high school with the lowest graduation rate and highest out-of-school suspension rate. The area's boundaries include Spokane's major north-south thoroughfare, Division Street. To the west, the city's limits to the east, Francis Street city limits to the north, and I-90 to the south. In addition to the natural boundaries created by these roads, the area also represents some of the city's highest needs, including poverty, crime, food insecurity, unemployment, and health disparities and low educational attainment, balanced by rich assets that set the stage for revitalization. The University District in the zone's southwest corner, the Sprague Targeted Investment Pilot in the southeast corner, and an undeveloped industrial and residential area known as the Yard in the zone's northeast corner. So these are the 8 neighborhoods within the Promise Zone. They're Bemis, Hilliard, Whitman, Nevada, Lidgerwood, Minnehaha, Logan, Chief Gary, and the northern part of the East Central neighborhood. So what exactly does the Promise Zone entail? The Promise Zone is a federal designation. It basically focuses on high poverty communities where the federal government will partner with and invest in high poverty urban, rural, and tribal communities to create jobs, increase economic activity, improve educational opportunities, leverage private investment, and reduce violent crime. After 2 rounds of designation, HUD, or the Housing and Urban Development, intends to designate 5 more urban communities as Promise Zones for a total of 14. 6 rural and tribal Promise Zones will complete the total of 20 designations. A total of 20 Promise Zones designations will be made by the end of the calendar year 2016. So it's a pretty competitive process. The Promise Zone designation will have a term of 10 years and may be extended as necessary to capture the full term of availability of the Promise Zone tax incentives if enacted by Congress. The Promise Zone's designation commits the federal government to an intensive partnership with local leaders who are addressing multiple community revitalization changes in a collaborative way and have demonstrated a commitment to invest in what works and make themselves accountable for clear goals and results. Just to be clear, a Promise Zone designation does not come with funding. It's more technical assistance and some preferences for certain competitive federal programs and technical assistance from participating agencies. So the focus areas for the Northeast Promise Zone that's where the application has been submitted are education, economic development and job creation, safety, housing, health, and resident engagement. And after the focus areas are the goals for each of those. And so what does our MOU entail for SRHD? These are the commitments that that SRHD said we will do. One is to lead a community-based effort to research best practices for alternatives to suspension, restorative discipline, and provide training. This is connected to the marijuana prevention funds, so we just received. And in the area of health, we have committed to provide in-kind support to collect data to inform strategies, primarily helping them with surveys, and then provide training on trauma-sensitive parenting practices. These are the partner organizations that have signed on as implementation partners for the Promise Zone. There's about 36 of them, including neighborhood councils for the neighborhoods. Questions?
Any questions from the board? Keith.
Can you tell me what commitments these other organizations have made to this process? Because I know some of them already have ongoing programs in the area and that sort of thing. Are there any other sort of obligations that people bring to this?
Most of the commitments, including ours, are existing commitments that we have in the neighborhood. So, for the most part, what we're trying to do is to leverage the resources that SRHD and those other partners are bringing into the Northeast Spokane.
Rowena did a really good job of explaining what's been going on for the last year and a half or so, and I'm pretty familiar because it's my district, and I've been working on it since Spokane Public Schools approached the city about it about a year and a half ago, and the key to this is, I guess it's this tricky way of the federal government trying to encourage local areas to engage in collaborative resource sharing and strategic planning. And so it's a 10-year plan, and it involves all those different areas with specific strategies in each area. And a lot of it is identifying what's already happening, but then the year and a half we've spent identifying everything that's happening has allowed organizations and agencies to then collaborate and do more and get better outcomes and find new ways of doing things. So one example is the Spokane Housing Authority. Most of the vouchers, Section 8 vouchers that they give out in the community to qualified folks are in a lottery system. But that means there's some families and potentially homeless students that may not actually get access to those housing vouchers. So one thing that came out of conversations about the zone was, is there a better way we could deliver these housing vouchers to those most in need, especially students at the schools in these neighborhoods? And so Northeast Community Center is one of the pilot locations where now the vouchers are given to certain agencies, and those agencies work actually one-on-one with families to get them housed. And the families are often identified by Spokane Public Schools or nonprofit agencies working with the families. So, and already the housing voucher rate of success is like 33% within a month to find someone to take your voucher, a housing location. But with this new strategy that was really developed out of these conversations, 80% of the families are finding housing within that 30 days of receiving their voucher, because these nonprofits are able to wrap around services and work with them to find the housing and to get the transportation needs addressed. So it's really, and those vouchers haven't changed. The number of vouchers haven't changed. It's how we're addressing and working together to to support individuals in reaching their potential in the community. So that's kind of another example. So it's exciting. We're hoping to hear back in May, June, if we are one of the finalists for a Promise Zone. It's a really competitive process. As Rowena says, it's only 5 in the country that will be designated, but we have a really strong application, and the city wants to, thank the health district for being an incredible partner in putting this together.
Mr. Hacker?
Kevin, I have one question regarding the Bemis area. I happen to be a Rogers grad many years ago. So how are you developing the Bemis area? What kind of strategies are you using? Perhaps Amber, I don't know which one to ask that would have that answer.
One is Regal Elementary considered to be in the Bemis neighborhood or Hilliard?
I think so.
But anyway, an example that came out is using the schools to actually address adult education. So here's another example. That's something that came out of the discussions. A lot of the parents of students that attend Bemis or Regal have not received their high school diploma. They would like to get their GED, but it's often challenging to find, to get to the Spokane Community College or wherever location that you can go to do that. So they've created a GED program at Regal Elementary in the evening with childcare provided, so parents of students that live there in the Bemis or Hilliard area can literally come and do their GED classes at the elementary school that their kids are going to. So there's another example of, it's not actually extra resources. The community college is looking to get more people into their GED program. This is just going to the individuals rather than asking the individuals to come to them. So there's another example of trying to help families in that area.
Any other questions? Thank you very much.
Thank you.
Next on the agenda is the legislative report from Linda Graham.
Good afternoon. So I think this will be a pretty quick legislative update. In your Board of Health packet, there was a list of all the bills that relate to your legislative agenda. This is as of the February 17th cutoff. It's the cutoff for the House of Origin, so bills would have had to get out of the House of Origin, House bills out of the House, Senate bills out of the Senate. And as you can see with the strike-throughs, there's not a whole lot of bills that are still active. Happens every session. But there are some pretty exciting ones that are still moving through the works. Most of them have at least gotten a hearing over on the opposite House side. The next cutoff is actually tomorrow, when bills have to get out of the policy committees, and then bills related to the budget have until Monday to get out of the finance-related committees. So any questions on those?
Is there anything else that we can do at this point around issues that we felt were important at this point? Because obviously there's been a lot of slash and burn go on here. And so, but there are some important things left. I didn't see any mention at all, or haven't looked specifically to see if the Senate has been taking up any of these issues. All of this stuff is coming from the House, it seems like.
A lot of it. There are some bills that are moving. Others have been scheduled for hearing, just haven't gotten the hearing yet. We're still waiting on a couple to see if they're going to make it out of their second committee. But most of them at least got out of the first committee, and then the ones related to the budget still have to get through the second committee. So waiting for that, hoping by Monday afternoon they get out of there. They are hoping not to do a special session. Session is scheduled to end on March 10th. They're pretty adamant. They don't want to do a special one. Certainly not 3. So because we won't have another meeting before then, I can send out another update. It would be helpful if you're interested in contacting your legislators about any of these in particular. To do so, if you need help for some reason, getting addresses or anything like that, just let me know. Okay. Anything else?
Any other questions for Linda? Amber?
Thanks, Linda. I know the capital budgets for the House and Senate came out yesterday. Is anyone that's like the State Health Board Association or the State Health Officer, has anyone done a review yet to see if the budgets from the House or Senate would impact these?
Yeah, we'll have a phone call scheduled tomorrow with LaSalfo, the State Association. I personally haven't had the time with the other things going on.
Let them do it.
So waiting to hear from them. I know they are working on a budget proviso on the operating side related. We've talked a little bit about the foundational public health services, really trying to identify what are those core public health things that every health district ought to provide in the state. We are working on some language in there that would call for joint efforts between DOH, the governor's office, WSALFO, and the legislature to work together during the interim to develop a plan for that and then to come forward with a proposal for the 2017 session. So I know that's a part of budget stuff that's happening right now, and I hope to get an update on that tomorrow.
Great. Thank you.
Any other questions for Linda?
Okay.
Thank you, Linda.
Great. Thank you.
For the record, please note that Commissioner O'Quinn has arrived. Item number 7, our consent agenda, consisting of the meeting minutes from the January 28th, 2016 meeting and approval of the vouchers for January 2016.
I make a motion to accept.
Second.
Moved and seconded. Any discussion? Seeing none, all in favor?
Aye.
Consent agenda is approved. This brings us to item number 8, the public hearing concerning smoking in public places law. Prior to opening the public meeting, I'd like to make a few quick remarks to those in attendance who will be providing public comment during the public comment period. Everybody should have received one of these or been able to pick up one of these public testimony and hearing decorum rules. I'd like to remind folks to please abide by the hearing decorum rules during this, so no clapping, cheering, booing, no public outbursts. And please, for all of us here, silence your cell phones. Anyone who fails to abide by these rules for any reason will be removed. If you have not had a chance to speak, you will not be readmitted, and you will lose your chance to speak. At this time, given the number of folks here, we're probably going to set the speaking time to 2 minutes per person in order to make sure that everybody has an opportunity who is listed to speak. Please remember that you need to identify yourself. The timer will be there. And one thing that we do ask is that if somebody has made remarks that support your position, you may wish to consider simply stating your opposition, or you are either for or against the resolution, and you either agree with the supporting or opposing statements regarding that, and move on to the next. We'd ask that we don't belabor a point too long. So with that, I would like to open the public hearing at 12:52 and ask for the staff report from Linda Graham.
Okay, this one might be a little bit longer than the legislative update. Thank you. For the record, I'm Linda Graham. I'm the Health Policy and Communications Manager for the Health District. And joining me is Paige McGowan, and she is our Tobacco, Vaping, and Marijuana Prevention Coordinator. So I want to start off by mentioning, we've discussed before that the action you're taking today is a little bit different than what the Board of Health normally gets involved in. Most often when you're doing resolutions, you're adopting regulations that have been promulgated by the state, or you're adopting resolutions asking, like the city or the county, to implement some kind of an action related to an issue. That's usually what the work that you've been doing. But in this case, you are actually engaging in rulemaking yourselves. And so this rulemaking is in the form of a resolution, just like your typical action. And should the resolution be adopted, then the direct effect will be result from that action. You won't be asking anybody else to take action. Your action is alone sufficient to carry out the regulations. So because it is a rulemaking, that's why we've undergone a pretty lengthy process. We've had a lot of public engagement, a lot of outreach that we've done, and education on the issue. We had a month-long public comment period, and then we're having the hearing today. So in short, the effect of your action will be that vaping will be prohibited in all public places and places of employment. And we will require no vaping signs that will be similar to the no smoking signs that are currently required under the Smoking in Public Places law. And because the Health District has an enforcement authority through our tobacco program, we will then be enforcing this action through our regular inspection and complaint process. So I want to be clear about what this is not doing. This is not banning vaping entirely, and it is also not doing any other regulations on the vaping industry of any kind. We have really limited this just to vaping in public places, and then a few other small clarifications related to the existing provisions under the Smoking in Public Places law. As we've discussed previously, enforcing vaping under SIP, it's not going to be unprecedented. This has actually been done in numerous local and state jurisdictions throughout the country, and several here in Washington State. And recently added to this list is the Kitsap Health District is also looking into the issue. So we've talked before about the rationale for taking this action, and I'm going to have Paige address these again briefly for you today so it's on the record here at the hearing. You will notice throughout our presentation that we really are focusing specifically on vaping. That's because the major provision within the resolution is to include vaping devices under enforcement of smoking in public places. As I mentioned, there are some other clarifying definitions related to the current smoking in public places law, but really the vaping has been the big issue, and it's really where the bulk of the public comment has focused. So, take it over.
Great. Thank you, Linda. So some of these we've covered before, but I'm going to go over them briefly just so that we understand our four justifications for pursuing this as a policy option. So although we call this vapor, the aerosol that is produced from a vaping device is not just a water vapor. It's been found to contain heavy metals, ultrafine particles, toxic chemicals, and cancer-causing agents like formaldehyde. Ingredients are not regulated, so vapor may contain varied byproducts. We do not know the long-term health impacts of being exposed to this type of vapor, and vulnerable populations, including pregnant women, children, and people with cardiovascular conditions, may be at an elevated risk of being exposed to secondhand vapor. Another concern here is that you can vape a variety of substances in the devices. This is problematic because bystanders don't know what they're being exposed to if somebody is vaping near them. Something that we've talked to you about already is our concern over an increase in youth using the devices. In Spokane County in 2014, 26% of youth reported, 10th grade youth, reported using a device in the past 30 days. This is a primary concern for us because nicotine use during adolescence is associated with lasting cognitive and behavioral impacts, including effects on memory and attention. Youth are vulnerable to nicotine addiction, and emerging research indicates that youth who use a vaping device may be at an elevated risk of starting to smoke combustible cigarettes. Lastly, youth are influenced by what they see, and social norms are really important here as we normalize smoking behaviors. Our last justification here is how this complicates enforcement. We have heard from numerous businesses about requesting guidance on what is required for them to enforce and what they can enforce. Some have expressed a desire to see SRHD take some action on this so that they are not the only business that prohibits vaping in their place of employment or public place. And SRHD has also received calls from the public with confusion around what's allowed. People in the public aren't sure about if someone's allowed to vape, and they don't really know what to do about it when they see it. This next piece is I want to talk to you a little bit about the comments that we received. So we hosted a comment period from January 4th through February 5th. People could submit comment via written mail or by email. All of the comments are in your packets for your review. All of the comments related to vaping. There was no comments related to any of the other details of the resolution. We did see themes from both people who were in support of the resolution and people who had concerns about it. The themes that we saw from the folks that were in support of this resolution generally were similar to the justifications that I've outlined for you today. And also of note, we did conduct an omnibus survey in 2014, large enough that it's considered generalizable for our population here in Spokane County. And we asked them what their view was about prohibiting vaping in public places. And 46% supported it, 30% were against, 20% were neutral, and 4% reported not being sure. So we've themed some of these comments up for you to review. Again, they're in your packet, but I'll show you and go over them briefly with you. We did have comments from concerned citizens. In short, they are not convinced that vaping devices are safe, and they're concerned about the public health impacts of breathing secondhand vapor. Here's a few more comments. This person highlights a concern about vulnerable populations, including people with lung disorders. More comments here. This person notes being impacted by secondhand vapor while being in a restaurant. We also heard from some advocacy groups. The example that we have here is from the American Cancer Society. They are concerned about chemicals and toxins that have been found in the vapor. They also highlight research indicating that people exposed to secondhand vapor absorb nicotine similarly to those exposed to secondhand smoke. We heard from a wide variety of medical professionals who were expressing concern over the impacts of secondhand vapor. Here's a few more. These were from physicians echoing concern over vapor as a public health hazard. And here's a couple more from medical practitioners, just showing their concerns about bystander exposure. We also heard quite a bit from people who use vaping devices, and unanimously, many people recognize the need for some amount of discretion or regulation concerning where the devices can be used. Here's some examples of their comments. We heard from concerned citizens about growing influence on youth. This comment is from a mother of teenagers, and she talks about how her children's behavior is influenced by what they see. Further comments here about the attraction of flavors available and the understanding that we need to protect youth from influence. We heard the same thing from advocacy groups. Here we have the American Cancer Society and East Valley Community Coalition. Both highlight how seeing use in public places decreases perception of harm by our youth. And we heard the same thing from medical practitioners addressing youth initiation and dangers of nicotine use. Lastly, we heard comments about confusion around what is allowed and what is not allowed in a business. These comments demonstrate that not all businesses have a policy or know if they are allowed to implement one. We now want to cover the main themes expressing concern over the proposed resolution, and I'm going to turn it back over to Linda to take us through that.
All right, so when it comes to the comments that were expressing concern, it appears that the bulk of these came from either vape shop owners or for those who use the vaping devices. And we had several themes among those comments, and I just want to go through those similar with what Paige did to give you an idea of what we heard, and then talk a little bit about public health perspective related to these. So one of the things we heard was concern about why we would take this action when there's the potential that the action might be preempted by either federal or state regulation. And as we've talked before, there is proposed federal regulation out there, and there's also some proposed state legislation, but neither of these address vaping in public places. They are limited to regulatory structure, testing requirements, licensing requirements, those kinds of things. And we were very specific in our regulation of limiting this to vaping in public places. We did not choose to add any kind of regulatory environment. That was us working with our leadership as well as with the Board of Health Policy Committee and consulting with some other public health jurisdictions, and really felt that it was best that we leave that regulatory structure to either the state or the federal governments. We also received several comments stating that there is insufficient scientific rationale for the action. These are a few of the comments that we received related to that. And again, a few more comments about research findings, including some noting that studies reach differing conclusions in regards to the vapor from the devices. So as public health has really considered the impacts of secondhand vapor, we've really drawn on a significant amount of evidence that is out there. And the consensus among public health officials is that there is sufficient evidence to justify taking this action. And as we in public health evaluate research, I just wanted to spend a minute to talk about the kinds of things we look for in understanding and assessing the research that is being done. So our considerations include the expertise of researchers. We really look at whether or not there is any potential for bias or any conflict of interest in the research, including who funded the studies. We really look at the methodologies. Was the study approach a valid methodology? Was it well designed and was it well carried out? We like to look to see if it's replicable, and we also look for transparency at all levels, including any assumptions that the researchers might have made in doing the studies. We do like to see that it's peer-reviewed and that they evaluate all potential alternatives for the conclusions that they're seeing. And then we also hope that we can find other studies that replicate some of those findings. And in preparation for the hearing, we did provide numerous studies for you to review. These are just a few samples of the study titles that we considered in looking at this action and that public health agencies around the country are using. And they really bring to light some of the concerns related to secondhand vapor. So we also heard some comments regarding the difference between cigarette smoke and vapor. But because of the SIP law, we actually don't have secondhand smoke anymore. So in the context of the proposed action, what the relevant comparison is really between clean indoor air and vapor in the air. And so it is this difference that is really of concern for public health, is the fact that instead of just clean indoor air, we're having vapor in the air. We also heard from some who believe that we should leave it to businesses to decide whether or not to prohibit vaping in their businesses. But as we saw before implementation of the SIP law, we feel a lot of businesses will not take action to limit vaping in their stores. A lot of businesses don't understand that they even have that authority to do so now. As Paige mentions, we're getting a lot of calls and a lot of confusion around the issue. So we feel that absent government action, a lot of businesses may not ban vaping devices, and so in order to protect the public health, some form of action is needed. Also, I want to note there's a issue of proximity when it comes to businesses. A lot of businesses share ductwork, they share walls, they have common spaces that are used. So even if one business were to limit the use of vaping devices, they still may be impacted by vaping in neighboring businesses. So we also heard lots of comments related to vaping devices being used as a means to quit smoking. These are a few of those. And some of these express concern about the fact that the proposed action will limit where they can actually use their devices. And I just want to note that nothing in the proposed resolution will limit someone's choice to attempt to quit smoking by using a vaping device. The only thing the resolution will do is limit where they can use the vaping device, and it would prohibit them doing so in public places and places of employment. And finally, we got several comments concerning sampling. It's very common practice in vape shops to allow sampling of their product. We heard very clearly from vape shop owners that they feel the ability to allow their customers to sample the products is really a part of helping people to experience it, understand what it's like, and find a product that will really work for them. And most of them have told us that they would like to see an exemption in this resolution that would allow vaping to continue. So public health in Washington and elsewhere, we've really given a lot of thought to this issue and really tried to understand where the vape shops were coming from. But really, our staff, our leadership, and also the policy committee from the Board of Health that we worked with recommend against any kind of exemption related to sampling. And the reason is there's really several significant implications to doing so. I want to go through those just quickly. One is that the smoking in public places law was designed to protect employees from secondhand smoke, and it doesn't have any exceptions in it, except for 25% of hotel rooms are allowed to allow smoking. So creating exemption for sampling and vaping products just wouldn't be consistent with the underlying intent of the law. Also, sampling is not permitted in retail stores that sell cigarettes, marijuana, or cigars. So allowing sampling in vape shops would be an exception to the standard that's already been established. Also of consideration is the fact that delivery people, maintenance personnel, those that services these businesses would be exposed to secondhand vapor. Tacoma Pierce, they originally allowed sampling under their smoking in public places law that when they added vaping to that. And then after receiving numerous complaints from the service industries that had to go into the stores, they've actually changed their regulations now related to sampling. And then as noted earlier, there's the proximity issue of impact on neighboring businesses who share ductwork or walls or spaces. And then concerns about complicating enforcement under the law. You know, if people see it happening one place, not elsewhere, it just confuses. We're complaint-based. We rely on people to tell us when they're seeing issues happening. So we're concerned about the confusion with that. We're also concerned about youth exposure. Youth are allowed to enter vape shops. They could be exposed to the sampling, also the cloud competitions that also, often can occur in the stores. And again, back to Paige's concern about youth exposure to things becomes a social norm, tends to decrease their perception of harm as well as then increase their interest in actually undertaking the behavior themselves. And then finally, there is not a lot of quality control around the liquid nicotine, and this can lead to adverse impacts if someone experiences a lot of vaping. We have actually heard from the Washington Poison Control Center that at least one person has been, who visited multiple vape stores and participated in sampling, ended up having seizures as a result of that activity. So just in closing, you will have the option at the end of the hearing today to do a vote on this action, or you can postpone it to March or a future meeting. Right now, under the resolution, the effective date would be July 1st of 2016. And this would provide somewhere between 90 and 120 days that we can do some education of the public, work with our business owners, and also provide time for required signage to be displayed. And we will actually be creating some signage for business owners. So that's all that we have today for your staff presentation. If there's any questions, happy to take those, or we can turn things over to your public hearing.
Thank you, Linda. Questions? Keith?
Linda, just a couple of questions.
Yes.
how would this resolution impact the reservations or casinos or whatever that are outside of normal jurisdiction?
Right. We would not have jurisdiction over those.
Okay, so those would still be outside this
Right.
resolution. Okay, and the second thing, I know I've read all of the comments and everything, and I haven't really read a lot about youth, though. And you mentioned that youth access or can access a vape shop. So they would have access to purchase materials.
But they're under this current state law.
Yes.
It is a violation to sell to a minor. So they
Okay.
wouldn't necessarily be allowed to purchase,
So they can
but they
be
are
there.
allowed to enter a shop, yes.
They can be there.
Yeah.
They can participate with someone else who's vaping.
I don't
Even
believe
though
that's
they
common
haven't
practice. From
purchased?
what I've heard, most of the vape shops are being very careful
Okay.
in terms of youth, so I don't believe that's a common practice.
Okay, but they can be present. Okay, thanks.
Anyone else? Thank you, Linda.
All right, thank you very much.
So we will now open the public hearing. First of all, let me apologize. I misspoke earlier regarding the 2-minute time limit. I've reviewed the sign-in sheet and see approximately 24 folks, so we will allow our typical full 3 minutes for public comment. So that is my error, so we will do that. Timing, go ahead, Amber.
Mr. Chair, I was just going to ask, at this point, is the board, I know up on the screen we had a couple different options for action. We could choose to take action today or wait till our March meeting. I know that I'm running a city council study session at 3:30, so I'll be leaving around 3:15, so I'll listen to as much testimony as possible, but I just wanted to let you know. I didn't know if you wanted feedback from the board on whether or not we wanted to make a decision today or just hear from the folks who came.
So I'm actually glad you brought that up because I was trying to remember our last meeting. We had a conversation about whether we're going to continue this for decision only to our March meeting so that the board members who were not present had the opportunity to listen to the full hearing. And I cannot remember what we had decided. Did we?
We had.
We didn't decide.
We did not
Okay.
decide at that time.
So I'm not trying to, I think if we want to listen and just see how things go, that's fine with me, but I just wanted to let you know that that was the time frame I had to leave, just in case you lost the forum, or
Okay.
the quorum. Thank you.
All right. So let us begin. A 3-minute time frame. I will call out public speakers in the order in which they are signed in. If I mispronounce your name, please forgive me. I will apologize up front. First on the sheet is Dr. Alexander Grand.
Council members, thank you.
Dr. Grand, and this is for all other speakers, I apologize. Please state your name and affiliation or address for the record.
Sure. My name is Dr. Alexander Garrard. I'm the director for the Washington Poison Control Center. So thank you for hosting us today. My area of expertise is in the toxic effects of drugs and poisons on human beings. You're going to hear a lot of testimonies today, and you're going to hear a lot of people sharing and refuting data along with anecdotal evidence and experiences. I just want to challenge you to think long and hard about the differences between some of those anecdotal experiences and evidence-based medicine and studies. Many people will say that the studies are inconclusive regarding the health impacts of liquid nicotine and should not be used to harm small businesses, but here's what we do know. Nicotine is dangerous and can have a toxic effect on the body and on the developing brain. There's no arguing that. Since e-cigarette devices came on the market, there have been alone 59 cases here in Spokane County. Of those cases, 70% of those have been in children. While the number of cases may be small compared to the total number of cases the Poison Control Center receives in a year, the issue is that this is a product and industry which to a large extent is unregulated and not controlled. Harmful toxins have been found not only in the vapor but also in the flavoring agents. So diacetyl is a chemical that's been linked to popcorn lung, and studies have found that that chemical has now been found in 75% of flavors out there. Formaldehyde-releasing chemicals have also been found in the vapor of e-cigarettes. And for those individuals who will say that formaldehyde is not found or the e-cigarette doesn't get hot enough, I just want to bring your attention to the fact that there have been a number of e-cigarette products out there that have actually caught on fire or have exploded in people's hands, causing significant injury and morbidity, including here in Washington state. The actual devices are also known to leak liquid nicotine from their chambers, and they're also being used now to vape other substances, including marijuana. We received a number of calls at the Poison Control Center on this. There's even a vaping device that looks like an albuterol inhaler that's being meant for an asthma attack. So my concern here is that the vaping devices are being normalized through extensive marketing for youth and social media. These products are meant specifically, smoking and vaping in public places only further anesthetizes our youth to the dangerous health effects of nicotine and sets them up for a lifetime of nicotine addiction. I strongly urge you to pass this resolution as it is, and let's not repeat the public health mistakes of the past. Thank you.
Thank you. Next is Paul Schneider.
Good afternoon. Thank you for having me here. My name is Paul Schneider. I am a father and also a 20-year educator, and I teach here in the Spokane area. I can't speak to the science as well, but I can speak anecdotally. First, as a teacher, I am in high schools every single day of my life, and I have noticed a huge increase in the amount of usage regarding vaping among my own students who have very little understanding of the potential harm and danger in that, partly because of the extensive marketing. I grew up when cigarette manufacturers could sell and market to children. It took us years to finally reduce youth smoking rate, and I'm only seeing increases in the vaping world among my students. And while they tell me they are simply using water vapor, I know better that many of them are actually using nicotine and marijuana in those particular devices. As a father, I have two young girls, and I'll speak again just anecdotally. We were at the mall a couple of months ago, and a group of young people were vaping inside of the mall. My 12-year-old said, "That looks disgusting, Dad. Why would they be allowed to do that here?" My 8-year-old said, "That looks interesting, Dad." And I do not want my 8-year-old interested in any kind of a device that could potentially get her hooked on either nicotine or access to marijuana in any way, shape, or form. And while I respect people's rights to vape in private, just as I would to smoke in private, those rights don't necessarily extend into our schools and into my children's lives. Thank you very much.
Thank you. Next we have Jim Royston. Jill? Sorry, my apologies.
Thank you, Board, very much for hearing us today. My name is Jill Royston. I'm a Student Assistant Specialist with the Northeast 101 ESD, and I work out of North Central High School. This summer I had the privilege of working on a project called Photo Voice with these amazing people behind me. So Michelle Barton, she's a sophomore at Lewis and Clark High School. Caleb Bope is an 8th grade student at Sacagawea Middle School, and Peyton Royston is an 8th grade student at Sacagawea Middle School. So what we challenge them to do with Photo Voice is to take pictures from their own perspective of a health issue or a public issue, this one being health-related specifically. And the question that they came up from that was, where can you use a vaping device? For them, they really wanted to know. So part of the project is I will share with you pictures that they took, and I'll ask them to share what's the meaning behind the picture. And we'll start with Michelle.
I originally took this picture thinking that it would look cool. I wasn't having any reason to, I just took it. And it wasn't until I looked back on it that I realized that it has a message. This is a young person stomping out a cigarette. We are taught young that cigarettes are bad and that we need to stay away from them. But ads now don't tell us anything about e-cigs. They tell us that they're cool, that they're better, that they don't harm us, but they really do.
So the next picture I'll share with you is we did a project where we went out into the neighborhood. We went in a couple different neighborhoods. This picture was taken in the West Central Community Center. This particular shop is right down the street from an elementary school. And Caleb's experience for this.
I think this is scary and overwhelming, seeing the bars and all the signs of e-cigs, because it is different from my community, which is friendly and loving. And I can only imagine the younger kids that have to grow up in this environment and what they will begin to create habits of and discuss, and habits of and devices they will use opposed to someone who has a different background.
And last but not least, we kind of came up with a final goal, and Peyton will share with you what we also found. We went out into the neighborhood in downtown, so a business that had taken it upon themselves to actually already put some signage out.
We ask that you make it clear where you can use an e-device within the community. For example, when we took this picture, this was one of the few businesses that posted something about e-cigarette restrictions. Thank you. Are there any questions?
Last but not least, I had the privilege yesterday of just going in for my own personal understanding of a pot shop. And as I walked in, I saw a device that looked exactly like a blue electronic device. And as I went in and I asked, how would you know the difference and what exactly is in that particular device, I was alarmed at what quickly a young person could get their hands on, how quickly they could potentially be in a catastrophic situation because of the amount of marijuana that was in there. However, I myself would have probably mistaken it for an e-blue device. So I would have assumed it was nicotine related. Thank you.
Thank you very much. So that was Michelle, Peyton, and Caleb, correct? Thank you all for your comments. Based on that, next on our list is Kelly Cruz.
Good afternoon, board members. My name is Kelly Cruz, and I'm chair of the West Central Community Prevention Wellness Coalition, and we are funded through the state DBHR to actually promote a positive message in the community in the prevention of alcohol and other substances. I have a letter that I'll enter the record, so I won't go over everything there, but I want to gloss over some of the things that we have concerns about, particularly the types of chemical substances can be used in these devices, marijuana oils and other derivatives, and also illegal substances. We are also concerned about the vapor byproduct. There is no tangible data out there as to the effects. We know what comes out of them, but we don't know the actual effect on exposure in limited spaces and close proximity. So that is a concern of ours. The last thing I'll touch on is basically what vaping devices are chemical delivery devices because they use a chemical that is vaporized and inhaled. So we don't know what the actual outcome of extended use of these products is. There's been no data or studies to actually see if we're trading one addiction, that being the use of nicotine, for another addiction to another secondary chemical. So that's some of the concerns from a prevention standpoint for us. And the normalization of the product, as was mentioned by others, to youth. Recently, data has shown that youth cigarette smoking is down, but the use of vaping products is quadrupled. So that is of concern because there are no regulations as to what one can use and the dose that one can use. So I strongly support, and our coalition strongly supports the proposed regulations. We would hope that you would enact them as proposed, and then we can work with the community to address further issues. Thank you.
Thank you. Next we have Rosetta Barclay. Barkay?
It's Barclay, and I said I didn't.
Oh, I'm sorry. There was kind of a question mark there, so okay. Excellent. So now we have John Jamerson. No. Josh, sorry.
Good afternoon. My name is Josh Jamerson. I'm with Smart Smoke Incorporated. We're a locally owned and operated electronic cigarette and vapor shop. Thanks for your time today and the public voice of the matter. I'll stick to my script here. There's a lot of comments I'd like to say. I know we're limited on time. On behalf of the entire Smart Smoke team, we also greatly share concerns for public safety. We too have been striving to help the public for the past 7 years. Along this journey, we have seen many tears of joy and relief from customers, yet not a single story of a doctor recommending to a patient to return to tobacco. In fact, not even a single report of adverse health effects. We have many health professionals, including that carry PhD titles, that are off the record recommending our products to their patients. These include physicians, dentists, lung specialists, chemists, and more. In SRHD's outline of evidence, it mentions including vaping and SIP will prevent renormalization of smoking. We disagree. We feel that It will not renormalize, but rather reinvent the future of what smoking could be, the potential of saving 480,000 American lives a year. In current SRHD.org infographic, you quote, "Tobacco is a leading cause of preventable death." We do agree with that statement, and as a community, we have a chance right now to seize the opportunity to do just that. Prevent deaths from tobacco-related illnesses. The CDC's most recent study of all approved tobacco cessation programs has a success rate of only 6.2%. That's combined. If we group together tobacco and electronic cigarettes into this new law, will that cause public opinion to be that they're equally as harmful? If so, is that going to increase or decrease the amount of people who currently use tobacco and those using e-cigs now? Will making people who are proudly using electronic cigarettes stand beside those that are standing outside be safe for the e-cig users? Isn't that putting 20% of the public in guaranteed harm's way? Are we looking at this issue from 10 or 30,000 feet? At 10,000 feet, we may just be reacting to good intentions. But what does 30,000 feet look like? Does a 10 or 30,000 foot view give merit to such a revolutionary invention? Are we still not yet able to recognize a good thing due to societal displeasures? If the new SIP law is passed as it is currently proposed, there's a fortuitous issue to contemplate. It cannot truly be enforced like tobacco for two major reasons. One, there is no smoke as there is no combustion. And two, there's no lingering smell as there is no smoke. If the new SIP law proposed passes, but is unable to, one, guarantee that people won't vape when no one is looking, two, guarantee to decrease the amount of experimentation with minors, three, have a measurable protection of public health, and finally, if it is unable to truly be enforced, then what goals of the proposal are actually being met? If passing this law would increase the probability of reducing the number of tobacco smokers in our community, thus helping the overall public, we would back it 100%. Smart Smoke is in strong opposition of the proposed inclusion of electronic cigarettes in the current smoking. Thank you, guys.
Thank you. Next, we have Travis Hottinger.
Close enough.
Thank you.
Thank you, Travis Hottinger, also from Smart Smoke as well. I'll make this quite quick here. One point I would like to make is that this will completely tarnish this industry. The worst thing to ever happen to electronic cigarettes is the name. If this passes, people will just see electronic cigarettes equal to real cigarettes, putting them in the exact same group. Sorry about that. Now, there's a proven 4,000 plus chemicals in at least 43 known cancer-causing agents in high levels in traditional cigarettes. Speaking on behalf of Smart Smoke, we have 5 main ingredients. Pretty easy to do the math on that. People will continue to slander the use of e-cigs, stating they're just as bad as real cigarettes, when that is completely false. As for nicotine, it's prescribed to patients instead of Ritalin in Canada. It also has very positive effects with Alzheimer's patients. In a recent study by the Journal of Regulatory Toxicology and Pharmacology, they found e-cigarettes produce 85% less nicotine than traditional cigarettes. E-cigs tested were an 18 and 24 milligram strength on that. Now here's the problem with many negative tests against e-cigarettes, the levels. You could pretty much test anything and find chemicals in them these days. Toxic levels are what we should be considering, not 1 part per billion in some cases. Look at California. They slap a warning label on anything and everything that they see as a threat. Don't go into Starbucks in California, even they've got a warning label for 7 different cancer-causing chemicals. We need to wait and not make rash decisions before actual reliable studies are done with e-cigarettes. Please don't stop the chance of saving someone's life from tobacco. Thank you. And from a personal standpoint, I started smoking when I was 10 years old, and I did not stop smoking a single cigarette until I was 28 when I got one of these. Thank you. That's all I have.
Thank you. Next is Rob Coombs.
Good afternoon. My name is Robert Combs, and I also work for Smart Smoke. We feel the independent business owner should continue to have the right to allow or deny the use of vapor products within their own establishment, and this would simply entail offering 2 different signage options for the public's clear understanding. The continued use of the standard no smoking sign, or 2, the use of a duly prohibited no smoking or vaping sign. Standalone vape shops need to be permitted to vape indoors. Samples are important for two very big reasons. Sampling flavor profiles, or the try before you buy, are a key competitive advantage over the entire online marketplace. The loss of this vital advantage would surely cause economic hardship to the local vape shops, thus our local economy. A major part of any vape shop is the ability to diagnose customers' product for suggested replacement parts. This would be near impossible without indoor vaping being permitted. Without this ability, we will literally be guessing and potentially costing our customers economic loss on a misdiagnosed suggestion, or two, our business loss of goods will in the eye of the customer from such. Ultimately, this would further loss of a competitive advantage to the global marketplace via internet, causing even more economic loss for local businesses. Sampling is at the moment when a smoker becomes a believer and makes the switch. Without the ability to vape in standalone vape shops, it will ultimately result in a decline of local shopping and a higher tobacco use in our community from the lack of sampling and product knowledge and support. I suppose it goes back to what our goal here is today: to impose a law that is unenforceable, causes tobacco cessation rates to decelerate, causes our economic local hardship, or to truly help the public by riddling our community of tobacco. The possible secondhand vapor. We have a chance as a community to rid Spokane completely of tobacco use in the years to come. We are not saying that e-cigs are as clean as air, but they may not be as bad either. I want to read you a recent quote from a 112-page study done by Washington State University on Spokane. First, we conducted a simple screening test to see which of the air toxins exceed a screening value based on cancer and or non-cancer risk factors. This shows that of the 15 core air toxins, chloroform, beryllium, and lead exceed the chronic screening value, the CSV. In order to establish more quantitative exposure levels, we ran an EPA hazardous air pollutant exposure model using air quality data gathered. Model exposed for cadmium and nickel were below the CSV, except using the CSV, except for the nickel and the neighboring surrounding in the CZ site. But benzene, butadiene, carbon tetrachloride, tetrachloroethylene, trichloroethylene, acetaldehyde, formaldehyde, arsenic, chromium, and manganese exceed the health screening value in Spokane neighborhood. 90% of those long, big words are either known carcinogens or heavy metals, and traces are being inhaled literally right now.
Thank you. Next is Sarah Clement-Sampson.
Thank you. I'm Sarah Clement-Sampson, the Community Benefit Manager for Providence Healthcare, and I'm part of my job within Providence Healthcare is to do our community needs assessment in partnership with a health district, which we just completed our 2015 needs assessment. And within that, utilizing much of the data that's provided from the health district, we identified substance abuse as an issue underneath as a subcategory of mental health. Nicotine is a substance. Whether it's in cigarettes or whether it's in e-cigarettes, it's still a substance. And changing that over and making that normalized harms the work that we're trying to do to help decrease smoking rates, maternal smoking rates that came out in your own infant and maternal health report. Those are all things that we're working to do, and the passage of this would be beneficial in our continued partnership in how we're going to address these issues. Thank you.
Thank you. Next is Joey Blodgett.
My name is Joey Blodgett. I'm the General Manager for Sublime Vapor. I'm here to talk about the sampling primarily, and to also let you guys know that all of my products do not contain tobacco, period. They are either vegetable-based nicotine or lab-created. Tomatoes are the primary source of nicotine. So to come after us for something that is along those lines, it's tomato-based. The youth prevention program, if we could possibly work on eliminating the black market, would help out quite a bit. I do know that there's Facebook groups there's a 15-year-old that is selling e-liquid to his buddies. If you want to really go after it, go after the kids that are selling it already, that are buying it online. Don't come after us shops. In the shops, if we allow sampling, we can prevent people from picking the wrong juice. All the juice I have has no diacetyl in it. It's all lab created, and it's all U.S. ingredients. We're not farming it out. We're not buying e-liquid from China. We're keeping it all local. Youth-wise, I provide a safe place for kids to hang out They don't have to vape. Not everybody vapes in my store, and not everybody uses nicotine. I personally am a zero vapor. I have been since the very beginning. I've never smoked a cigarette in my life, but I was a cigar smoker. I tried to light up a cigar a couple years ago. I couldn't even touch it. It was awful. I stick with e-cigs. I do zero nic. I don't do it for nicotine. I'm not addicted to nicotine by any way. I actually have a mild nicotine allergy. I have a propylene glycol allergy. And everything I do is primarily vegetable glycerin, which vegetable glycerin is either coconut or palm oil. It's pretty much all vegetables. Some of the studies that have been put out there have been completely biased by big tobacco. The UK and Europe are both in massive support for vaping as not only a tobacco cessation device, but just a safer alternative to getting nicotine. That's pretty much about all I have to say. Thank you.
Thank you. Next, David Phillips. Thank you.
My name is David Phillips, owner of Smoking Legal Vapors. We have 4 stores. Been in business for about 7 years. I really appreciate you guys taking the time to hear what we have to say. As I said, I've been involved in the vaping industry now for nearly 8 years, and I own 4 vape shops. I could go all the way into the amazing stories of how vaping has affected in a positive way so many lives, but that would literally take all day. Since the inception of my business, we have only ever sold to adults over the age of 18. And I continue to be really impressed with our e-liquid manufacturers, their dedication to provide top quality, child-proof bottles and liquids that do not contain diacetyl. We all believe that there should be some regulation and uniformity in this county. But at this time, we're very concerned that this misunderstood industry is causing an unjustified panic, and that a vaping ban restricting use of this product, even in our vape shops, is simply over the top. We're here to help people. I can recount numerous times where educating the customer is the paramount thing in getting customers off analog cigarettes. Not being able to troubleshoot their devices or allow them to sample in our stores to determine the proper nicotine level, the proper flavor that will get them to succeed, simply makes no sense. Vaping in certain public venues, I believe, should be up to the property owner. I also strongly disagree with the statement going around that vaping is a gateway to smoking or other things, because in my 8 years, I've never seen it. And I've come across thousands of customers who have never seen it, so I just don't buy it. In regards to the rumors of a sin tax, which is coming down the pipe on vaping products, this would only chase customers onto the internet or to Idaho to make purchases. I employ 12 awesome employees. Right now, I'm able to pay them well and provide 401ks. A tax like this would change all that. And in closing, as a former law enforcement officer, I would like to remind you of the days of Prohibition. The city, the county, and the state would end up losing the proven approximate $70 million the state of Washington gets in revenue. And let me say they enjoy that. People will just go, once again, to Idaho, or that is our bordering state, and the industry will be driven underground. Now, this is really important here. In a recent court's judge decision in New York, her name is Judge Laura Johnson, she ruled that vaping is not smoking. The case number is 2015 KN037186. Vaping is not smoking.
Thank you.
Thank you.
Scott Peterson? Patterson, thank you.
Hello, Hello, thank you for having us here today. My name is Scott Patterson. I'm an insurance agent here in Spokane. I'm also a vapor, and I also happen to be representing Average Joe's e-juice company here in Spokane, which is a local manufacturer of e-juice that many people here use. The e-cigarette business was spurned out of a need for a safer alternative and more effective cessation tool to a product that kills 480,000 people in the United States each year. According to the American Cancer Society, 100 million people were killed in the 20th century by cigarettes, and they expect that to be 1 million to die in the 21st century due just to cigarettes. Governments all over the United States are rushing to regulate and or ban vaping products and usage as quickly as they can, while their counterparts in other countries are embracing this harm reduction option. Why is it that the most anti-vaping message is coming out of the United States? While the actual unbiased peer-reviewed studies are coming out of countries like Greece, Spain, and the United Kingdom. I urge you to read the peer-reviewed studies that are available with a simple Google search. I have brought 3 with me if anybody would like to read them. But again, they are available on Google and just about anywhere else you look. In closing, I would also like you to take into consideration many of the businesses here in Spokane that would be affected by this change in the law. Not allowing customers to try the safer alternative to smoking through the means of tasting and tasting different liquids, trying different devices, and educating people only pushes people further away from quitting a product, which most doctors agree is more difficult than quitting heroin. Allowing people to learn about e-cigarettes in a safe and educational setting like a store allows people to take back their health and begin to make healthier decisions. Just since I have 40 seconds left, I would like to say when I first started vaping, I had smoked for 20 years. I walked in and talked to Stephanie over at Smokin' Legal, had my first mech mod, and I was excited about it. I had no idea what I was doing. The videos that you see online of people who have their explosions in their pockets and whatnot are because they have no idea what they're doing. And by making people not be able to try devices, try liquids in stores, we're in effect making it more likely that we're going to have more explosions, more fires, more injuries due to lack of education. So thank you, Smokin' Legal, for that especially.
Thank you. Luke Davis.
Hi, my name is Luke Davis. I've been a longtime client or customer of Vapor Lounge throughout the years. I have a study here. It's a 212-page peer-reviewed, well-cited article from the National Center of Biotechnology Information, which is part of the United States National Library of Medicine, which is also part of the National Institute of Health. So far, everything I've read about all the heavy metals that are involved with this have been found in such trace amounts. The heaviest one is mercury, in 0.17 nanograms, which is a billionth of a gram. For those of you that don't know, they allow 1 part per million mercury in tuna fish. As for all the other studies that have been done in opposition to this, there is 1 times 10 to the 15th exponent of free radicals in traditional cigarette smoke. As for what's in e-vapor products, almost none. Let's see what else we got here. There's a common belief that nicotine promotes cardiovascular disease. It has been established that nicotine has a minimal effect in any atherosclerotic heart disease. Any platelet aggregation at all does not affect coronary circulation. And for those that have ever had a blood test, nicotine doesn't affect your blood test. That's pretty much all I got, There's a bunch of studies that are around, all scientific, all heavily peer-reviewed, all well-cited. I'm heavily in opposition to this because there's nothing to back it. Absolutely nothing. There are many smokers out there, including my wife. She's got asthma. Ever since she has switched to an e-cigarette, her lungs have been way better. Her respiratory system has been far improved. Her doctors have told her your lungs are clearer than they've ever been. She has decreased her asthma inhaler usage from 4 times a day, and she was only smoking half a pack of the little Virginia Slims, down to 1 at night before bed. There's nothing that can back this. As for I'm reading through here, and I'm seeing there's an appeal to youth. Most of these youths, they see the vape competitions, they use zero nicotine. They don't use any nicotine. My cousin is one of them. He's 17 years of age, high school athlete. He was being scouted by the Fighting Irish for a while. He was a linebacker on the football team. Zero nicotine. He watched his mom smoke for years, seeing how her system went down the tube, saw when she got on e-cigarettes, it was good for her. She got back up and started being able to run again and all that kind of stuff. It hasn't affected his performance in football. Yeah, that's about all I got. So, thank you.
Thank you. Next is David Johnson.
Thank you very much for having me. My name's David Johnson. I work for Smart Smoke Incorporated as well. I just want to say, I understand why we're looking at this law because of the stigma of, vapor products and smoking. They are a close link because we are seeing former smokers use these products. But with that, don't panic because it's not the poison that kills, but it's the amount of poison in your system. I'd like to reference a Public Health in England report of 2 major studies over 5 years of research. This is being signed off by the Queen Mary of London, King's College of London, and UK Centre for Tobacco and Alcohol. Conclusive evidence shows that there are in fact measurable trace levels of chemicals within vapor. However, they are far below the international accepted levels of even US FDA-approved medical inhalers. Due to the support, Europe is having an unbelievable decline in tobacco smoking rates. I may add that Public Health in England is part of the European Union and has adopted even stricter public health regulations. I apologize. Kind of fighting off a little sinus infection right now, too. They are primarily claimed to be the worst case scenario. E-cigarettes are 95% safer than tobacco products. There are literally chemicals in everything from water we drink to the air we breathe. But again, it's not the poison that kills us, it's the quantity of the poison. I want to make a quick note from Public Health England publication that stood out to me. The potential of e-cigarettes to help improve public health depends strictly on the extent of which they can act as a route out of smoking. So, with my personal use, I was able to quit overnight. Within 2 weeks, I'm running 3 miles without dying. Before that, I could barely get half a block. I love seeing people quit smoking. I don't want them to use my products for the rest of their life. I want them to stop. But what I really want is for them to live life how they should and give them that freedom.
Thank you. Next, we have Julie Gill.
Hello, I'm Julie Gill. I own Hot Rod Vapors, and like everybody else's stories, everybody's doing a great job. Our stores are exclusive to vaping products, only vaping products. The people that come into our stores are coming in for vaping products. Because they vape or because they are trying to find an alternative to quit smoking. The healthier alternative is going to vaping. We educate every day. We troubleshoot. If somebody's having problems with their hardware, or you have that person that's coming in at the age of 70 years old who's decided, I want to live a long time. At 70, you have to be able to help them with their hardware and explain to them how that hardware works and teach them how to use that. By taking that away from us, it's not letting us do what we do in helping others. People go to a winery to taste wine. That's the reason they go. It's not because they're looking for a fruit basket. We also know that alcohol has health risks. So there is really not a whole lot of difference between going in and tasting wine and vaping on an electronic cigarette. Thank you.
Thank you. Next is Karen Sacco. Maybe I'm not saying that right. Sacco, last name?
There was a gal here that left.
Then we will move on to Joanne Peterson. Or Petson? Dotson. I said up front I wasn't going to take any responsibility for slaughtering people's name.
Dotson. Members of the board, it's a pleasure to come to you today. I'm Joanne Dotson. I'm Dr. Joanne Dotson. I'm a PhD nurse researcher at Washington State University College of Nursing. I'm also a very old public health nurse. I have been doing public health for about 25 years, and I've been in practice as a nurse doing pediatric and inpatient nursing since the 1970s, before the Clean Air Act was originally passed. So I saw a lot of changes in hospitals and other settings over the time that have been a great benefit. I speak in support of Initiative 901. For several reasons. One of them is because my experience with pregnant women and parenting families is that exposure to tobacco and other substances, I recognize that not all of vaporizers are have nicotine in them, but the unknown is what we need to be aware of. I do have clients, I do research with pregnant women, and I have had clients asking about using vaping, and I said I don't have good enough data to provide you with knowing it's a good idea or not. Specifically, what I do know, and this is from the CDC, is you shouldn't be using both combustibles and vaping if you're going to, and that's one of the issues. Very often people want to use both. I do recognize a very rapid growth of e-cigarettes and a lack of knowledge to go along with that. I do know that dual use is quite common in my populations that I'm working with. I'm working with tribal college students in Montana as well. It's fairly common. I also know that secondhand smoke has and continues to be a concern, and we just don't know about secondhand vaping, vapor. So in the absence of evidence, I would urge you to err on the side of safety. It took us 30 to 40 years to document causal relationships between prenatal nicotine use on low birth weight, and about 20 years to figure out that secondhand smoke it was harmful for children. This is an opportunity to protect the health of the public until we know for sure. I understand there's lots of studies out. There's lots of studies, but they have not been done in a setting, and we don't know what the outcome is. It deserves more attention. So, thank you.
Thank you. Next we have Luke Patterson. Did I get that one right?
Yes. Hello, I'm Luke Patterson. I was with Smoking Legal Vapors. Now, I have never smoked a cigarette. I started vaping because I have a stress disorder, and I found that nicotine helps with that. I would just like to bring to attention that we were told that there are no exceptions to the SIP rule, but I know there's at least 8 hookah lounges right here in Spokane. There is smoking indoors, and I would just like to have it available to be able to do the sampling inside the shops, because the knowledge of how to operate a vaporizer is very important, and being able to set people up with their flavors is also very important. That's my time. Thank you.
Thank you.
Can I see your device?
Yes.
It's in your pocket, right? No, I don't want to touch it. Okay, thanks.
Next we have Sydney Hine.
Hi there, my name is Sydney Hine, and I am the Spokane County representative for the Pink Lung Brigade. They are a pro-vaping advocacy group. The Center for Disease Control concedes in documentation online that e-cigarettes appear to have far fewer of the toxins found in smoke compared to traditional cigarettes. The National Institute for Health and Clinical Excellence and the Medicines Healthcare Regulatory Association in the UK also acknowledges that their use is safer than continued smoking. WebMD says the biggest danger from tobacco is the smoke, and e-cigarettes do not burn. Test shows that the levels of dangerous chemicals they give off are a fraction of what you would get from a real cigarette. A study published in the medical journal Addiction looked at over 3,500 smokers and had them use e-cigarettes. According to the medical journal, most smokers turned vapors, at least 92%, reported that the e-cigarette helped them quit or reduce smoking. Users of nicotine-containing e-cigarettes reported better relief of withdrawal and a greater effect on smoking cessation than those using non-nicotine e-cigarettes. Excuse me, sorry. I would also like to mention another thing about vaping is the safety aspect of things. Vapors have no litter to toss about freely as cigarette users do so frequently with cigarette butts. The fire hazards of smoking cigarettes are far more significant than vaping simply because there is no open flame with vaping devices. And most vape shops have many informational charts and literature on how to properly use, maintain, and customize your device in the safest way possible and provide atmospheres where both experienced and inexperienced vape users can exchange tips and safety knowledge. Tobacco products have been taxed for years, but not all e-liquid has tobacco in it. In my personal opinion, the state is more concerned with being able to tax a product to make a profit than the actual safety of the people. If there are trace amounts of aerosol and vapor emissions, then we should also reconsider the usage of fog machines, humidifiers, inhalers, and aerosol-based cleaning and hygiene products. The main point of my discussion here is to propose a compromise with the city of Spokane and continue to allow vape shops to allow vaping in their shops. It provides a safe environment. It provides knowledge on how to safely use devices, and it definitely creates less of a black market as far as people creating liquids at home where they do not know what they are doing. So thank you for letting me speak today.
Thank you. Next is Esther Larson.
Good afternoon, Board. My name is Esther Larson. I live in unincorporated Spokane County. I'm a mother, a grandmother, and by profession, I'm a biochemist and an attorney. And as a matter of disclosure, I am an employee of Spokane County. I'm assigned to the sheriff. I'm here on my lunch break, fairly long one. At any rate, I'm also a co-leader for the Washington Alliance for Drug Endangered Children. And I support the resolution that the Health District has before it, and I urge that you approve it for many of the reasons that have already been stated. But I'd like to also mention, as a matter of science, as a research biochemist, I am well aware of the impacts on the cardiovascular system of nicotine. And in regard to prevention and the youth, as a member of many of the prevention coalitions here in Spokane County and across the state, we've dealt with children whose first use of any type of drug was nicotine. We've seen and heard today of children who are using these devices for smoking of marijuana. And I think that prevention is critical, and it's a necessary thing for youth not to be exposed to this or for them to be under the influence of what has been described as some enticement of these devices and information that is given out regarding the fact that the devices will not be harmful or the ingredients harmful to the youth. I have two current publications. I'd like to have them become part of the record. And willing to help the Health District and others in prevention obtain more of these if necessary. Last, in regard to secondhand smoke and public health, I really think that it's important for those of us like myself who ride the bus and are pedestrians. We're lucky to have a CTR program that the county and your employees here at the Health District also can partake in. And as an employee in a public building, we really need to make sure that the signage that you have is clear and concise and that there is enforcement of any ban that takes place, because that often is not happening. And many individuals who are, for instance, near the bus stops don't understand the harm they're causing to the public. So thank you very much.
Thank you. Next is Torrin Cates. Thank you. So Mr. Cates is not here. William Lockwood.
I'm Dr. Bill Lockwood. I'm Chief Clinical Officer at Chaz Health. We're a local federally qualified health center that takes care of about 57,000 patients. I had all kinds of things I was going to say, but they've all been said more eloquently than I could. So I'll just say that I'm completely in favor of the proposal and agree with all the comments that have been made in favor of that proposal. Thanks.
Thank you. That closes the, or at least concludes the people we have signed in for comments. Is there anyone in the audience at this time that would like to give public testimony? Please state your name for the record, and I'd ask you to sign in if you wouldn't mind.
My name is Jeff Benjamin.
Oh, you can do it up there. Thanks.
My name is Jeff Benjamin. I'm part of Smoking Legal Vapors. I wasn't going to speak today because I'm pretty shy. I don't want to really get up in front of people. But what I have to say is I've got several employees from the Chaz Clinic that shop with us. I've got several people from Rockwood that shop with us. Plenty of people that are in the medical industry that have no problem coming into our vape stores and making their life better by vaping instead of smoking. It's not right to not be able to help people in any way. It can be banned in the mall, ban it in Walmart, ban it in restaurants. That's perfectly fine. No vapor in here cares about that. What we want to do is continue to help people inside the vape stores because that's where it really matters. There's no doubt that it's better than smoking. So if we have to take baby steps to get people better, then give us our baby step to let people come inside the stores and the stores only. That's what we ask. Let us help people on a daily basis get their life better and then let them make the decision to quit nicotine because everyone in here, we all have a brain. We can make our own decisions. We're adults. And that's what we ask. Let the adults come into our stores. Let us help them. That's all we want. And that's really all I have to say. Thank you for your time.
Thank you. So anyone else wishing to give public testimony? Yes. No, I actually did think he signed it. Oh, second. Anyone? Second call? So go ahead and go to the podium and state your name and address or affiliation for the record, and then sign in afterwards.
My name is Connor Schell, and I'm just a normal person like everybody else in here. I go to work every day and drive a car that doesn't get great gas mileage. And I smoked a pack of cigarettes every single day for about 5 years, and I started smoking when I was about 12 years old. Now, that's pretty young to start smoking cigarettes. Now, why did I start smoking cigarettes? Well, because of stress, because it was cool. Other people were doing it. I also smoked pot at a young age. And I did that all because other people were doing it. And lots of other people are vaping and stuff like that today. And I think it's fantastic because cigarettes hurt so many people every single year. You look at what's killing most people in the U.S., and it's cigarettes. You look at the studies with vaping, and it just says pretty much that it's not as bad. I mean, it's obviously not going to be healthy to inhale anything that's not air, but there's going to be much safer alternatives to tobacco. And that's all I have to say. Thank you.
Thank you. Anyone else?
I'm Jordan Rogers, and I'm a personal vapor. And really, I think it's dumb because, like, if you go into a vape shop, you're obviously going to want the products that you're going in there for. And, like, you're going to be around the vapor if you're going around the shop to buy those products. So I think that you should be able to vape in those areas. Now, I don't think you should be able to vape in public areas other than vape shops. But vape shops, I believe it should be allowed because that's where you're going in to get the products. Anyway, that's what I just had to say.
Thank you. Anyone else? Second call. Third call. And that concludes public testimony for the resolution before us. And we will now close the public hearing. Thank you. So next is item number 9. Action item is the resolution 1601, adopting RCW 1610 by reference. So at this time,
Before we do that, can we still ask some questions?
yeah. So I guess at this time, Member Baldwin would ask to ask questions. Do you have? Would you like to recall Linda? Or
yes, I recall Linda. Oh boy.
Go ahead, Keith.
Thank you. Linda, I just had a couple more questions that people brought up that I just wanted some clarification on. Right now, is it true that there is no tax other than sales tax on vaping products? Is that true?
Correct.
Unlike other substances which do have taxes, including candy and other bad things for kids.
Right. The only tax on there is your standard sales tax.
Okay. All right. The other thing I wanted to ask about, because a number of people raised this issue about if you can't enforce it, don't make the rule. And I don't necessarily disagree with that. Can you go over enforcement a little bit with us? How we enforce a regulation like this?
I'll ask Paige to do that since she's one of our enforcement folks.
Yeah, no, I think it would just be informative. Thank you.
Sure. So I am responsible for the enforcement of smoking in public places. We are primarily complaint-based. You can submit a complaint on our website or by phone. You can come in person. We'll accept complaints. However, we follow up on all of those. We have a proper standard protocol for responding to those. We also do random inspections a couple of times a year in partnership with the Liquor and Cannabis Board as well as the fire department, where we go to different locations and walk in and make sure that they're in compliance with the signage. You're required to have signage on all doors that open that says no smoking, and no smoking within 25 feet, and no smoking within any public place or place of employment. So if we see that, we follow a process. We receive complaints and we do random inspections, and this is how we would continue to enforce this exactly the same as we do now.
So one thing you said was a key point in my mind was that we're not the only ones enforcing these regulations. Could you explain who else enforces them?
We are the only ones who enforce this, but we do, when we do random inspections, we typically go out with other agencies who are looking for other things that they're responsible for enforcing. So we have done random inspections on our own, so at any time we can go out and do them, but primarily we're complaint-based.
Including hookah shops?
If we get a complaint about a hookah shop, we will go to the hookah shop. We can also do random inspections. Mm-hmm.
Okay.
So I actually have a follow-up. That kind of led to my follow-up question. Are there smoke shops, hookah shops, whatever you want to call them, cigar shops that currently allow for smoking inside?
The only ones we know of is there are some hookah facilities. As Paige mentioned, we do work through a process of enforcement on those entities. As far as any sort of sampling in cigarette or tobacco shops, there is no authority
I don't mean
for that.
sampling. I mean,
okay.
I guess, are there
like a lounge?
Are there cigar? Yes,
Lounges?
Is there a cigar
No.
lounge? Is there? I mean, are any of those currently offered or allowed under state law?
Allowed under state law? No.
Okay.
Other questions for Linda as part of discussion? Thank you, Linda.
All right, thank you.
So moving to discussion amongst the board, do we have a sense if we wish to take action at this time, or if we wish to take the testimony given and under consideration and then move for a decision at our next or future meeting? Any input on that? Any thoughts? Lori.
No.
I'd like to consider there are a number of people not here, and I wonder if we should give them a chance to weigh in on this and observe the written testimony. And I'm just throwing it out there. I don't know the answer. I'm just throwing it out there for consideration.
Keith?
Well, I was just going to say I haven't talked to, but I have heard several people say that they were going to look at some of the information, and it's been available on our site for a while, and I did read through all the comments and everything. So I think even if people aren't here, I think Bob Lutz said that he would prefer that it move on and not wait for him, but he would like to have access to the information, which he already does. So I guess I would be more in favor of hearing what any of the other board members here are thinking today, rather than waiting a whole month, because then I'm going to have to reread everything all over again.
Shelley or Al, any thoughts?
I'm fine taking an action today. So depending upon what the position of the rest of the board is, I'm either willing to do it today or next month. I'm neutral on that.
Chuck?
Well, after looking over the information that we received and listening to the testimony today, trying to couple all of that together, I think that, I didn't take a number of who's for or who's against. However, I look at the number of physicians that have provided testimony, plus the owners, and I can understand the dilemma that they are having relative to being a vaping area. However, as most of you know what my background has been in relative to young people in high school, I just, at this point, looking at, again, the information, I'm willing to make a determination today.
John?
So I think the only thing I'm struggling with on this, because the whole vaping in public places thing, that's just an obvious one to me. I don't support smoking in public places. I think I'm struggling with the whole sampling thing, and I am not a smoker. It's nothing I've ever supported. I have kids. I don't want them to use vaping devices. I understand the concerns around the vaping devices. I think the piece I'm struggling with, and maybe the reason I'm leaning towards wanting to do a decision in March is the opportunity to do some more research on this, is I'm struggling with the whole idea of the online market that we may be pushing folks to. And I don't know if that's a legitimate concern that's been raised today or not. I think that's the only piece here. So I guess I'd love to hear what some of the other board members are thinking around that piece. I mean, are we really is this something that's going to exist anyway? And we're driving it to an online market that may not be as safe. I'm curious what the other thoughts are. That's the only piece in this I'm really struggling with.
Thank you.
Well, I have thought about this quite a bit, and I think it comes down to two things for me. I think one issue is prevention. And I think I've heard a lot of people talk about prevention, including people who are providing the vaping products and how they want to maintain control and all of that. I think that's very responsible. And I think that is one of our positions here at the health district, is to try and prevent issues from occurring by trying to take in all the information we can and make good decisions. So I think prevention is a big thing in my mind. I think the other thing that I'm trying to balance is the whole issue of the fact that we're not taking away vaping. Vaping is not going away. Anybody can still vape. It's just this whole public places issue. And I'm still struggling with that a little bit, but I think from my mind, the prevention issue is the stronger issue here, that's really why we act as a Board of Health, is to try and prevent things. So I'm sort of weighing more heavily in that area.
Amber?
I was just going to ask Linda, was Tacoma the only city that initially allowed the sampling to occur and then ended up kind of changing that position? And how long was that? Like a 6-month period, a year? Just wondering. I guess that's I was hoping to get a little more information about what other communities have experienced, and was there any impact to those businesses, in all those other communities that you listed up there, in terms of not being able to sample for those businesses. That I'd like to do a little more research into that area. So that was just one question I had.
Okay. We have some information about what's happened in Washington State. I don't know the details on all the other jurisdictions that have done this. My understanding is Tacoma Pierce passed theirs in 2011 and modified it in 2015. And I believe Snohomish allows a sampling exemption as long as there's no nicotine. No nicotine. But all other jurisdictions don't have exemptions.
Okay, so under that, when they don't allow the nicotine, I guess my question would be then, so would that allow for them to be able to help their clients with the use of the product or the device? I mean, is this an option for a compromise on it?
But now you're talking about the enforcement issue.
Well, that's when, if they're doing random inspections anyway, for the health district, we do random inspections on restaurants all the time. So I don't know.
The complicating factor there is currently a lot of the e-juice, as we call it, does not have labeling requirements under the federal or the state law. So it is very difficult to know what is in there, so it would be very difficult to enforce whether it was nicotine or not.
So I've got a question for our attorney. With regard to the sampling, if I can appreciate the fact that if you're a customer and you go into a vaping store, you make a decision that you're going to go into a vaping store, and so you should, whether you're surrounded by it in the store or you're surrounded by it at home, that should be neutral. But if you've got an employee in the vapor store that is not a user, and then they're subjected to the vapors and everything like that, is that are there any legal ramifications or any legal consequences associated with having an employee that is not a user of the product?
Well, the SIP in general was designed for exactly that purpose, so that individuals that were required to pass through a business or near a business or work in a business would not be subjected to secondhand smoke. And those same rationales, at least, would apply to secondhand vapors. If you're somebody who is coming to fix a copy machine or fill a water cooler, then you're still exposed to those things, whether or not you are choosing to use a device or not. So that's the kind of analysis. Then the other thought that comes to my mind is not all vape shops are standalone box stores. They are, in malls or kiosks, and so when there is sampling going on, it's pretty impossible to limit that vapor to that location.
Just a question, again, another question for our attorney. If we were to modify this in any way, does it go back out to a public hearing? Or what's just the process question there?
If there are substantive changes, then the normal process would be to allow people to comment on the changed resolution.
Are you suggesting a change?
The only change I would make if I were to do that would be around allowing it. But the more allowing the non-nicotine samples. But again, I would be more along the lines of it would need to be. So this would probably get substantive. I wouldn't support that in the mall, for example. To me, that's a big open public space. If you're talking about a closed shop where that's the only thing they're doing, I think that's a different circumstance. So then I'm wondering if at that point we're getting into a more specific, a substantive change. But then at the same time, I'm also interested in hearing there didn't seem to be any opposition around the whole idea of preventing the vaping in public places. So really the comments, so those who were speaking in support of this really were speaking in support of it around that aspect. Those who were speaking against this were very specific on one item. So I guess I would like to be able to hear from others, okay, if we're just focused on this one item, then what are the pros and cons of that one item? So I'm not even necessarily opposed to going out or to having another hearing just on that one piece, because I would be interested in knowing what the thoughts are around it.
To conclude my question is that if it's an isolated shop, a vapor shop itself, and they're not using nicotine products that they sell, and the one gentleman I believe simply said his ingredients or his material did not include nicotine, would that make a difference of what we're discussing and talking about from that point of view? I hear it, and it's supposedly it's a nicotine smoking type thing that we're looking at, and if there's nicotine involved in the vaping, then I would say that would fit. If it's not vegetarian or whatever, then that puts a different wrinkle. But now are we getting too specific, or what? I guess we go back to our original thought of what the resolution says. And exactly what it means. And I know, Michelle, you can probably maybe explain that more specifically, because I'm sitting here as a vapor shop, period, and I'm just wondering, they can sell the materials and so forth, but they have to try it at home or somewhere else and say, gosh, I don't like this one, so I'm going to go back in a different kind. So our proposal today would take care of that. So again, there's exceptions. There's always exceptions to the case, but I think that this covers pretty a broad theme in that.
I think it currently excludes all vaping, regardless of what is in the inside of it.
Right. The proposed resolution prohibits vaping in any public place or place of employment, and I think it's important to keep both of those things in mind, because you will have people moving through those areas, whether it's a box store or not.
Well, Shelley, that's why I asked the question earlier about can children go into a vape shop or be in an area where people are testing vaping, and yes, they can. I would not be in favor of changing the resolution unless you're also going to address that issue, because I wouldn't want my children being in an area where people are testing vaping products.
To be honest, I'd be okay having it say it has to be a facility that is restricted to over 21. I mean, or however, whatever.
But that's somebody else's jurisdiction. I don't think that's
not
ours.
within. Well, you could put it in your ordinance. Again, you're getting to we're going to have another hearing if we go down that road. I want us to have the discussion. I don't want us all to sit here and not even talk about the issues that were raised today. I want us to actually have the discussion, and we seem to be focused around this one piece. So,
Lori?
Can we ask Linda to come back up, please? Sorry,
Linda.
Linda, could you return to the podium, please?
Linda, why don't you just stay up there?
Do you want a chair?
That'd be nice, Kim. Thank you.
I apologize.
Sure.
Is there any jurisdiction that you know of in the state of Washington where there is a designated place within a shop, a designated place to try the product so that you're not exposing workers or people who might pass by to vapors?
I don't know of any that get that specific in the regulation, no.
Okay, thank you.
Which jurisdiction allows it that you just mentioned?
I believe Snohomish allows sampling as long as there's no nicotine. And then Tacoma Pierce initially allowed any sampling. They have changed it now so that, I'm trying to remember all the requirements. I know there's things related to your ventilation system, that it has to be a completely isolated system. That has some certification, I believe, from HVAC experts. Yeah. Was there anything else related to age in theirs, or was it just the HVAC?
Tacoma is age and a licensing requirement.
Okay. Oh, and yeah, that's the other issue is Tacoma also implemented a licensing requirement, and some of the other jurisdictions did as well, so that we know where all of the vape shops are and can then do the follow-up on enforcement and the inspections to make sure they are complying.
So here's where I am. So when the presentations were done earlier, I mean, it was really, I felt like presented, and I don't mean earlier today, I mean in our previous one, it was presented that no other jurisdictions allow for the exemptions, but it seems like there are some. I would like to continue this for decision in March. I would like to know what some of those other exemptions are and what they look like. I'm going to be completely honest, I am not in favor of smoking or vaping. But I would like to see if there is something that could allow for, I'm just throwing this out here as where I am, that would allow for something similar around the non-nicotine issue. But I would like to know what some of the other jurisdictions are doing. I mean, to say that they're not doing anything and then to provide two examples here tells me that we don't have all the information. And so I'd like to even take a look outside of Washington State as well.
Are you withdrawing your motion?
No, my motion is to continue this till March for a decision.
Are you putting that motion on the table?
That's my motion. So if someone wants to, it's out there. My motion is to continue this for decision in March because I would like some more information. So if there's a second, great. If not, then someone else can make a motion.
At this point, I'll second. Okay. So we have a motion on moved and seconded. Discussion of that motion. Amber?
So I guess Council Commissioner O'Quinn is kind of where I am. I had missed the briefing on this at the board level last May or April, but we had some conversations and I read through some of the materials, in the meantime, and I had been told that in Tacoma, that they had allowed the sampling and then kind of made a change in that, but it sounds like there's some nuances there that I would really like to know more about. There's an age maybe and like other issues that they added into that, and so and Snohomish allowing the sampling of the non-nicotine products. I wasn't aware of that either, so I'd like to get some more information about that and have a chance to even contact some of the public, the board members of those organizations to find out, how did they come to their decisions. So, and what's been the experience from that. And Snohomish, maybe it's not working. We don't know. So I would like to know more about how that is working for their agency and enforcement. So I would support the motion.
Chuck and then Lori.
Would that also mean then we'd have another hearing?
No, I think this is for my motion. We do our homework, and then in March it's for decision only. So in March, what we could do is come back. We could either make a decision to support the ordinance that's on the table, or at that point we could say that based on the information that we've gathered over the last month, that we actually want to amend the ordinance that's been put forward. And at that point, then our legal counsel would tell us if she views that as a substantial change. If she does, we would have to have another hearing. If she thinks it's minor enough, then we wouldn't. So that decision would be made in March.
That makes sense, Michelle?
Oh. Yes.
Okay.
Lori?
I support that as well. I'm not comfortable going forward with the information we have now. I would like to go perhaps outside the state of Washington just a bit to Idaho and Oregon. Thanks.
Don't look to Idaho.
Ouch! Don't pick on our brothers to the east. So we have a motion on the table to continue this to. Oh, I'm sorry, Al. Please.
So, if we are going to look at trying to create some kind of structure that allows for in-store sampling, I would like to suggest that has got to be in a fully contained room with an independent exhaust system that would prevent the escape of any kind of vapors out into either the general sales area of the store or any other adjacent space, and that it also be accompanied with a minimum age, so that you prevent the opportunity for a child to accidentally end up in that room and then get exposed to it. So that's just where I would end up being at. I forget who said this earlier, but this motion doesn't make vaping illegal. It just makes it illegal in open spaces. And I've heard the comment made before with regard to smoking, and it's suggested here that should have the right to do this, and quite frankly, your rights stop when they infringe upon mine, and I am not a smoker, and so whether it's smoking or vaping or anything else, I still find all of that an infringement. There was somebody that made a comment that the poison is not significant to have any detrimental impact. I don't want any poison in me. I'm sorry. I don't care how much it is, and to say a little bit is okay is nuts from my standpoint. It was interesting. Just on the Today Show this morning, they did caught an individual in a security camera on a store. He was checking out of the store, and all of a sudden his pants caught on fire because the battery in his cigarette had exploded, and he was rushed to the hospital with second-degree burns. So I just if education will prevent that from happening, then that's great. But I don't think that education has to happen in a sampling room. That can happen with instruction manuals or a variety of other things. So just, I support the motion to extend it on, but just trying to give guidance to staff in terms of what I would like to see if we're going to allow for some kind of sampling situation on site. Thank you.
Yeah. And my last statement, I think the information that we're requiring, that staff needs to know explicitly what we need in order to make the decision come March.
Susan?
I'm fine with extending this until next meeting, but I would like to see provisions made for voting for people who will not be present at the next meeting, but were present for today.
Well, and I would also add that those who are not present today need to review the record. And I believe that's a requirement if they're going to vote.
Yeah, absolutely. If someone hasn't reviewed everything that occurred today and have a full import of the information, then they shouldn't be voting in March. And similarly, if there's additional information presented in March, those that are not here need to have a way to be privy to that before they vote.
Okay.
So I guess my question is, does that delay voting until April then, so people can read that information?
We can have a discussion about that, but there have been times, depending on how many folks we have, that we have allowed individuals to participate by telephone so long as they can hear everything that's going on.
So we have a motion to delay until March that has been moved and seconded. Continue for decision only. The public hearing is closed. All in favor?
Aye.
Aye.
Abstain.
So we have one abstention. Thank you. So seeing as it is 2:35, do we have any board updates? Any members wish to give any updates during this meeting? Board check-in? Keith?
I'd just like to say I appreciated the fact that we did get a lot of information in, and I also did my own work as well on the side, because I think it's an important issue, and I appreciate all the work that staff has done to help prepare us for this. So I was prepared to vote today, but since that's not going to happen, I did do my homework. Thank you.
Well, anyone else?
Just saying, there are lots of ways to do your homework.
Anyone else?
I would say that I think most of us read the information presented to us. I think it's one thing to read, it's another to hear testimony. So I think there are questions and ideas raised today that allow us for an opportunity to make sure we make a very well-informed decision. So I appreciate that we're kicking this until March.
Anyone else? Motion for adjournment? Moved and seconded, all in favor? Adjourned.